In this video, we're going to be going over the oxygen concentrator. We'll talk about what it does, how to service it, troubleshooting, all those good things. So the oxygen concentrator's job is to take ambient air and concentrate it down to mostly pure oxygen. To do that, it requires a couple of different conditions be met, or at least ideal conditions, which would be a fairly low humidity environment, and then also air that's relatively clean, so not a lot of dust, things of that nature. If you don't provide those things, in other words, if you have dirty air that's kind of moist, the concentrator can still do its job, but it just is going to increase the frequency of which you need to service it. So again, dry air within reason, and then no dust is the big thing. So again, as it pulls that air in, there's a structure, two structures inside of this thing that are called the sieve beds, and those are the things that are actually concentrating the air. 99% of the time, when we have to service these things, that's what it is. It's servicing the sieve beds. Sometimes we have these in stock, sometimes we don't. I bring that up because what a lot of our customers will opt to do is keep a spare concentrator. If you don't want to be without a concentrator for, say, a few days, maybe up to 2 or 3 weeks, it kind of just depends. It's a good idea just to keep one as a backup. And then when this needs to be serviced, you just drop the other one in. You send us the one for repair. We send it back to you. You always have a spare. So that's just something to think about as well. Aside from having dry air, not dusty air, there's really not a whole lot that you need to know about servicing it other than this little filter right here. Your concentrator may not look exactly like this, but this is a common one that we use. But all of our concentrators somewhere, typically on the side, will have this little filter. You take off the part there, and then you have this little filter that you take in and out. These are super cheap. We can replace these if we need to, but really it's fairly easy just to kind of wash it out and then dry it really well, and then just stick it back in there and put the cap back on. You want to make sure, again, that it's dry before you put it in there, because like we talked about, we don't want to be sucking in moisture into the concentrator. That makes it work a lot harder than it needs to. The concentrator will turn itself on when the system comes on. We have this plugged up individually here so we can talk about how this thing functions. So when the system first comes on, you're going to notice when I turn it on here, the power light comes on, and then there's a couple other things going on. So when you first turn it on, you have this power light. You have, in just a second, this yellow low oxygen light that will come on. And then very briefly, you have that red light. That's all normal. You'll see the red light goes off pretty fast, but the low oxygen light stays on for a little while. So that's normal. So what's going to happen is that's going to be on for, say, 2-3 minutes, maybe up to 4 or 5 minutes. So it takes the concentrator time to be able to finally get that concentration up. So when you turn it on, if you were to measure the O2 coming out of it, it might be 30%. But over the next few minutes, it's going to gradually climb, and then it's going to get up to about 96%. And then you'll see that light go off. Even when the concentrator's off, you should have the green power light on, obviously. Once the yellow low oxygen light goes off, you'll see the light above it come on, which tells you that you have normal oxygen. So obviously that's what you want. And then obviously, if we have the red light come on at the bottom at any time, then there's some kind of alarm. There's probably going to be some kind of service needed. That's usually a situation where, like I said, you need to service your sieve beds. There could potentially be something else. If the system's not operated properly, it is possible to get water all the way back into the concentrator. We see that happen occasionally. So anyway, if you see a red light, you probably need to give us a call.